Radboud University Medical Center, commonly referred to as Radboud, is a major university medical center located in Nijmegen in the eastern part of the Netherlands. It combines high-level patient care, cutting-edge research, and comprehensive education under one roof. Its mission is succinctly stated as to have a significant impact on health and healthcare. History and structure. Radboud's roots go back to the mid-20th century, when the medical faculty and affiliated hospital in Nijmegen were established. Over time the entity evolved into a full university medical center. In 2013 the name Radboud was officially adopted. Today it functions as an independent organization affiliated with Radboud University, yet with its own supervisory board and governance structure. It is structured around three core missions: patient care, research, and education. These are intertwined rather than discrete silos. Patient care informs research ideas, research informs patient care approaches, education trains the next generation of professionals who must bridge all three. Patient care. Radboud provides both regional and super-regional, tertiary, care, meaning it treats routine as well as highly complex and rare conditions. It holds many so-called special functions licenses to deliver advanced treatments that require special equipment and expertise. Some key figures from a recent year include: over 215,000 patients seen, over 22,000 hospital admissions, nearly 30,000 surgical procedures, and an average hospital stay of approximately 5.9 days. Patient satisfaction is high, average rating around 8.7/10. With multiple outpatient clinics and a full range of medical specialties including trauma, oncology, neurology, pediatrics, through the affiliated Children's Hospital, cardiac care, and more, Radboud is equipped to handle both common and rare health issues. The facility also caters to international patients, providing information and guidance in English. Research and innovation. Research at Radboud is a major pillar. The center boasts state-of-the-art technological platforms, multiple dedicated research institutes, and a strong orientation toward translational medicine, i.e., taking lab discoveries into clinical practice. The research has been reorganized into thematic clusters, disease-oriented and generic, under three major institutes: the Radboud Institute for Molecular Life Sciences, the Radboud Institute for Health Sciences, and the Donder Center for Medical Neuroscience. Radboud is recognized for its digital and e-health leadership. It achieved the prestigious HIM Stage 7 award, which signifies a hospital that has fully leveraged electronic medical records and data systems to improve patient safety, process performance, and quality of care. Innovation also extends to design. The hospital's newer buildings emphasize person-centered design, smart building services, and environments that facilitate healing, comfort, and efficiency. Education and training. Education is integral. Radboud trains medical students, biomedical scientists, dentists, and other health professionals, and offers continuing education for specialists and paramedical staff. Students engage early with patient care, reflecting the belief that training within the clinical environment fosters stronger readiness for practice. With over 3,400 students and more than 500 master's degrees awarded in a recent year, the center is a substantial training environment. The Radboud Health Academy brings together the educational programs, supporting lifelong learning and professional development. Strategic themes and future focus. Radboud places emphasis on a number of cross-cutting strategic themes. Prevention and public health, shifting from reactive to proactive healthcare. Meaningful and prudent care, focusing on what matters to patients and avoiding overtreatment. Sustainability, reducing environmental footprint and promoting sustainable healthcare models. Data and artificial intelligence, using advanced analytics, digital health, and AI to personalize care, predict outcomes, and streamline services. Molecular mechanisms and new treatments, delving deeply into the biology of disease and bringing new treatments into practice. Why it stands out. Integration. The seamless integration of care, research, and education means that innovations can move quickly from bench to bedside. Scope and complexity. As a university medical center with many specialist roles, it handles rare and complex cases, making it a referral destination. Digital leadership. Its recognition, HIM Stage 7, shows it is among the top institutions in Europe for its use of digital health infrastructure. International orientation, it serves both Dutch and international patients, publishes extensively, and participates in global research collaborations. Patient-centered innovation, design of facilities, focus on satisfaction and holistic care all support an environment where patient experience is prioritized. Considerations and tips. If you are a patient seeking care, note that for specialist treatments you generally need a referral from a general practitioner, GP, or specialist. As with any high-level center, waiting lists may apply for certain clinics. For international patients, it's wise to check insurance, clarify costs, especially if not under Dutch health insurance, and confirm language support and translation services. If you are a researcher or trainee, being part of Radboud's ecosystem can provide exposure to high-level projects, but competition for positions, example PhD posts, can be intense and funding must often be secured. For anyone interested in hospital design, operations, or digital health, Radboud represents a strong case study, from its building design to smart infrastructure to patient data strategy. Final thoughts. In sum, Radboud in Nijmegen is a leading academic medical center, reflecting the modern vision of healthcare, one that is patient-centered, research-driven, education-rich, and digitally enabled. Whether you are a patient seeking advanced care, a researcher looking for collaboration, or a student training for a healthcare career, Radboud offers a compelling environment. Its combination of scale, expertise, innovation, and mission orientation make it a standout institution in the Netherlands and beyond.